Good afternoon, Chairman Schuler, Representative Fortenberry, and distinguished members of the subcommittee. I'm pleased to be here today on behalf of the CMS to discuss the Durable Medical Equipment, Prosthetics, Orthotics, and Supplies Competitive Bidding Program. This important initiative, required under the Medicare Modernization Act, has three key parts: quality standards and accreditation, financial standards, and competitive bidding. Together, these will help reduce beneficiary out-of-pocket costs, improve the accuracy of our payments, help combat fraud, and ensure beneficiary access to high-quality items and services. First, the Quality Standards and Accreditation Program and use of financial standards provide important safeguards for beneficiaries and the Medicare program. These safeguards also ensure a level playing field for suppliers competing under the competitive bidding program. Any bidder that failed to meet quality and financial standards was not qualified to participate in the program. The Quality Standards and Accreditation Program ensure that beneficiaries receive good customer service and have access to quality products from quality suppliers. CMS conducted a wide variety of activities to involve stakeholders in the development of these standards. Many, such as focus groups for small suppliers, were important parts of the development. The financial standards ensure that contracts only go to sound businesses that are capable of meeting beneficiaries' needs for the long term. Financial standards also help weed out fly-by-night operators that prey on Medicare and beneficiaries, in contrast to legitimate suppliers acting in the best interest of their patients. Under the competitive bidding program, qualified suppliers compete on price to be contract suppliers with Medicare. Contract suppliers then compete with each other based on quality and customer service to serve the beneficiaries in an area. CMS adopted numerous approaches to ensure small suppliers have the opportunity to participate. First, CMS worked closely with the Small Business Administration to develop a more targeted and new definition of a small supplier. CMS then designed policies linked to this definition to help small suppliers in the program. For example, suppliers are able to band together in networks in order to meet certain program requirements. The program also ensures a formula to provide that multiple contract suppliers are selected for each of the 10 product categories. Most importantly, there is a 30% target for small supplier participation in the program. If the winning group of suppliers is not composed of 30% small suppliers, CMS added small suppliers to the list of winners to reach this target. The initial round of competitive bidding is now complete, with the announcement of 325 contract suppliers this past Monday. We are pleased with the results. 23% of the bids submitted were in the winning range. 61% of the bids were priced higher than the winning range, though some of those were also disqualified. The remaining 16% would have been in the winning range. They were also disqualified. In the initial round of contract offers, 64% of the contracts were offered, again, to small suppliers. Ultimately, about half the contracts signed were those associated with small suppliers, clearly exceeding our target. When the new payment rates take effect on July 1 for the first 10 bidding areas, beneficiaries will begin saving money on 10 of the most commonly used durable medical equipment products, such as power wheelchairs and oxygen equipment. The average savings in their coinsurance and in Medicare payments will be 26%. We understand that the implementation of this program may be difficult for some suppliers because the law anticipates that there must be both winning and losing bidders. Non-winning bidders may still have opportunities to serve Medicare beneficiaries through providing non-bid products, subcontracting arrangements with winners, or as grandfathered suppliers for certain items, or by providing repairs and maintenance. We also understand that the new system represents a significant change in how suppliers operate under Medicare compared to the past, and we will continue to work closely with suppliers and make improvements in the program as we move forward. CMS is also conducting aggressive education and outreach to be sure that every beneficiary, partner, and supplier knows how to use the program well and ensure a smooth transition on July 1. CMS will also monitor the performance of contract suppliers through beneficiary satisfaction surveys, tracking the volume of questions and complaints that CHIPS and 1-800-Medicare receive. These and other activities will help us keep current on what is taking place on the front lines. In conclusion, CMS is committed to the success of this program. We have designed a program to provide beneficiaries with quality items and good customer service at a lower price from reliable suppliers. I very much appreciate your time today and the invitation to testify. I would be happy to take any questions. Thank you.